This is part 2 of the Healthy Environments presentation.
From that, then, let's think about the precautionary principle. And the American Nurses Association has adopted this precautionary principle as the basic tenet on which to guide its environmental advocacy work. And the precautionary principle says you're better safe than sorry, which means when an activity raises threats of harm to human health or the environment, precautionary measures should be taken, even if there's no scientific certainty about these effects. And the failure to take precautionary action can have very severe social costs. Millions of children worldwide have suffered from nervous system damage, diminished mental capacity, and thus the ability to make a living as a result of exposure to lead. And that's just one example. So, if we are going to enact that precautionary principle, then you have to have effective risk communication. So it's not just about giving people information in a timely manner, but is the information accurate, relevant, and in a language that people can understand? Are you giving information to the right people, those affected and those who are worried but may not be affected? And then at the right time for timely action or to allay fear. If you go back to the toxic ash site case study, you can see that there was not a timely distribution of information. Following from this is the environmental justice movement. And this was started by individuals, primarily people of color, who sought to address the inequity of environmental protection in their communities. Grounded in the struggles of the 1960s civil rights movement, this movement sounded the alarm about public health dangers for their families, their communities, and themselves. And environmental justice is fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. By fair treatment, what we mean is that no group of people should bear a disproportionate share of negative environmental consequences. Meaningful involvement, then, means that people will have an opportunity to participate in decisions about activities that might affect their environment and or their health. Now, the EPA's goal, then, comes from both of these, which is to provide an environment where all people enjoy the same degree of protection from environmental and health hazards and equal access to the decision-making process to maintain a healthy environment in which to live, learn, and work. Going back to the ash site study one more time, more than 4,000 residents say the city violated their civil rights. And I read this before, but they sued for dumping ash in the predominantly poor black neighborhoods and exposing them to health risks. There are a number of agencies, state, federal, and local, that are dedicated to environmental protection, and including, of course, the EPA, but also the FDA and the USDA. And there are many others, so please look in your textbook so you can see what these agencies are and what they have to offer in terms of protecting you from hazards in the environment. But the kinds of activities they do first would be permitting, which is a process by which the government places limits on the amount of pollution emitted into the air, the soil, or the water. Environmental standards may describe a permitted level of emissions, a maximum contaminant level, or an MCL, and an action level for environmental cleanup, risk-based calculation. And so environmental standards are required to address health risks. Compliance then refers to the processes that the different agencies go through to ensure that permit and standard requirements are met. But the recommendations that come from these agencies provide valuable guidelines to protect public health, but they cannot be enforced by law. The next two slides will show you just a couple of fun resources for where you can find information, but also that you can send people to, consumers in particular, adults and children. And Toxtown and Tox Mystery both come from the National Library of Medicine. Toxtown is really interesting. You can check on the type of neighborhood that you have. Maybe you live on a farm, or you live in a city, and find out what kinds of chemicals might you find in this area. You can look at a specific chemical and it can pull up the information about that, but also tell you where you might find it. So there are a number of different ways to access information about those chemicals, but it's a wealth of information and it's nice to have such an interactive tool. Tox Mystery, of course, is my favorite because you have Toxie the cat. And Toxie the cat is primarily for kids aged 7 to 10 to help find clues about toxic substances that lurk in the home. So children visiting Tox Mystery have Toxie the cat, who helps them find the hazards hidden in each room and offers hints when needed. So the objective is to find all the hazards in the living room, the bathroom, the garage. And the players are treated to a spectacle of Toxie dancing and more when they identify all the hazards in the room. I don't think this is just for children 7 to 10. I happen to like it myself. Let's review just briefly the nurse's role in terms of environmental health. Assessment, just like the exposure history we talked about, risk assessment that we talked about, and then also visual inspection, site visits. And I think about our windshield survey at this point and what you could learn about environmental health from that windshield survey. The next is advocacy. We talked about the precautionary principle as underlying environmental health advocacy as set by the ANA, and that enforcement of protections and regulations. But often we're also called to provide testimony about particular environmental health circumstances in neighborhoods where we're working. And then referrals. Referrals to all those different disciplines that you're working with in this particular circumstance. But really, occupational health nurses are nurses that we don't often come in contact with, but provide a wealth of resources for you when you're looking at environmental health. The next two slides offer you an introduction to a couple of different organizations that really work to integrate nurses into environmental health issues. The Alliance of Nurses for Healthy Environments was developed out of a call in 1995 from the Institute of Medicine to add more environmental health and nursing education. The Alliance is located at a website that offers nurses a place to find environmental health information and connect with other nurses around key environmental health topics like fracking and climate change. But you're going to find a wealth of information on hazards, on their health effects, and then also on tools for assessment and action. And I really suggest you go to this particular website. It's very interesting. Just finish it, Connie. And finally, there is healthcare without harm. So together, an international coalition of hospitals and healthcare systems share this vision of a healthcare sector that does no harm, but promotes the health of people and the environment. And this applies to things like medical waste and green building and energy and pharmaceuticals. But they're working to implement ecologically sound and healthy alternatives to healthcare practices that pollute the environment and contribute to disease. That's all that we have for this presentation, and there will be some other things on Blackboard about home environment.